We don't need more suppression. We need more restoration. Think of that, right? Suppressing hunger with a shot doesn't fix insulin resistance. Well, I mean, technically it does, right? It does fix it for a period of time. What comes in after that, though, is it doesn't clear the toxins or reset the hormones and really heal your gut for the long term, right?
Welcome to Health Decoded, your number one source for real health information, with your hosts, Dr. Alessi and Matt Tack.
Hey, Health Decoded listeners. Dr. Alessi here. Let me ask you a serious question. Are you tired of waiting until something goes wrong to finally see a doctor? At Alessi Functional Health, we take a different approach, the right approach. We believe true healthcare isn't about chasing symptoms. It's about preventing them in the first place. That's why we created the Alessi Total Care Program. This is a functional medicine-based membership that gives you proactive, personalized care year-round. You'll get access to comprehensive blood work and functional testing, custom doctor-grade nutraceuticals, deep discounts on labs, protocols, and follow-ups, as well as 24/7 direct access to your doctor, not just a 10-minute checkup that ends with another prescription. And here's the best part. As a Health Decoded listener, you'll get your first 3 months completely free when you sign up for an annual membership. That's on top of hundreds in savings already built into the program. This is your chance to take responsibility for your health and join a movement that's redefining what primary care should look like. Head on over to alessifunctionalhealth.com, click on our services tab, and go to Total Care. Learn more about this program and claim your exclusive podcast listener offer. Your health is your greatest asset. Let's protect it proactively.
Welcome back to another episode of Health Decoded. I'm your host, Dr. Alessi.
And your co-host, Matt Tack.
Matt, how you doing, man?
I'm doing amazing, man. Ready for this conversation.
I am as well. I think this is a very important thing that we've been hearing a lot lately. A lot of patients coming into the office frustrated, kind of tired of just being shelled out these medications. And so we were kind of, I know you and I were discussing hey, why don't we get into the nitty gritty of this, maybe ruffle some feathers a bit with it, and just really educate people on kind of, the risks of what we're going to be talking about today. And that being said, today's episode is all about the exploding world of GLP-1 drugs like Ozempic being used for weight loss. And we're going to break this episode down into 4 segments. So segment number 1, what is Ozempic and why is everyone talking about it? Segment 2, the hidden risks that no one's talking about and your doctors aren't telling you. And segment 3, the real root cause of fat gain and obesity. And segment 4, our functional approach to weight loss and health. And if any of this resonates with you, stay tuned for an awesome show.
That's it. So let's jump right in to what we're affectionately call segment 1 of this. So let's start with the basics. Because if you've turned on a TV, opened Instagram, or sat in a waiting room lately, you probably heard someone mention Ozempic, Wegovy, or Manjaro is how you say it. So these drugs were originally created for type 2 diabetics to help regulate blood sugar levels. But what they found over the recent years is that they exploded in the weight loss world like wild freaking fire. So you don't have to have actually diabetes. And in fact, millions of people are being prescribed them off label. So insurance isn't covering a lot of these right now either too. So insurance has actually taken these out. These are more cash based if you are not diabetic. So they can't be prescribed that way, but they're off label to just shed pounds. I know so many people, even actually in my family. So this actually hits home, right? So what are exactly these drugs is the question. So this is what we're here to document. They're called GLP-1 receptor agonists, right? That stands for glucagon. Is that how you say it?
Glucagon like peptide.
Glucagon like peptide, right? So they are peptides. And this is a hormone your body naturally produces in response to food. And it does several things, right? So it slows gastric emptying. So you feel fuller longer, right? You're resistant to food. It reduces the appetite. So similar to that, making you just eat less throughout the day, right? So caloric restriction improves insulin sensitivity, so helping regulate blood sugar levels, and lowers glucagon secretion, preventing unnecessary glucose release from the liver. So here are just a few like brand names that people are talking about. As we said, they're mainly called semaglutides, but Ozempic and Wegovy are two of the really, really big ones out there right now that many people are pushing, right? Mounjaro and Zepbound. These ones, which also stimulate the GIP receptors in addition to the GLP-1. So these are peptides, which we're a believer in peptides, but there also comes things, which we're going to get in other segments, of that not all peptides are actually created equal and how you utilize them appropriately, right? So these medications are administered as weekly injections and were originally part of a diabetes treatment strategy, but their weight loss side effects quickly became the main attraction. So here's why all this buzz is going around. Celebrities like Elon Musk and Chelsea Handler, right, have admitted to using them. Social media is flooded with the Ozempic journey, right? And dramatic before and after reels. You'll see now the Ozempic face after people have used it for a period of time, right? That droopy face that you'll see, the cheeks impounded. So, and more concerning, primary care docs and telehealth clinics are now prescribing them with minimal screening or lifestyle support, right? So there's no education behind that drug introduction. So here's the issue. These drugs weren't designed for casual use, and long-term effects are barely even understood at this point. So while they work, while you're on them, the moment you stop, the weight tends to come back and come back ferociously, right? Often with a real vengeance. You're essentially outsourcing your hunger regulation to a synthetic hormone and hoping your body plays along, right? But as we always talk about, everything's between the ears, right? So here's a study. In 2022 article in Nature Medicine found that GLP-1 receptors, agonists, were effective in helping patients lose weight. They came with significant gastrointestinal side effects, including nausea, vomiting, pancreatitis, and even gastroparesis, right? Additionally, weight loss reversed within 1 year in most patients who stopped the medication, showing the side effects are not sustained without continued use and lifestyle change. So we're medicating a metabolic problem without addressing the root in it. Nutrition, stress, sleep, toxins, hormones, and last but not least, movement.
That's a big one, man.
Yeah.
Yeah. And I mean, there's so much to that. And obviously let's get into the next piece, which is really the hidden risks that, no one's talking about. And I think the worst part of it is I have patients come in and they're like, my doctor didn't tell me this. And so what I instantly hear from that is like, okay, that is dangerous when you're not telling someone like, hey, you need to be following a healthy diet while you're on this drug, or you need to be moving your body. You need to be staying metabolically healthy. It's more so like, no, just take this. You're good. Do whatever the heck you want, right? Go eat whatever, do nothing. And this drug will do everything for you. Too good to be true often is, right? When something sounds like it is. So, let's be real. Like, I'm not here to shame anyone for wanting to lose weight. We help people lose weight all the time. And I understand the frustration of trying diets and working out and still feeling like you're stuck. This is very common. And so it's also like, what is the root cause of that? But the Ozempic conversation is way too one-sided. Everyone's talking about the results. No one's talking about the risks. And so it exploded so rapidly that everyone kind of jumped on it. And there wasn't enough time to really see, hey, what's the long-term side effects that are going to come from this? And now we're starting to see it a couple years later. So, let's get into it. I have a list here of really the hidden consequences or risks that doctors aren't telling you that we're seeing with these drugs. And so what's really happening, number one, is people are losing muscle instead of fat. yes, there is weight loss, but a lot of that weight is lean body tissue. And so when you drastically cut calories or suppress your appetite, your body doesn't just burn fat. It breaks down lean muscle too. And so there was a 2023 study published in JAMA that found up to 40% of the weight lost on semaglutide was lean body mass. That is dangerously high to lose that much muscle, especially when your body starts catabolizing that muscle, can lead to liver issues as well. And so, why does that matter? Because we both know this. We harp on this all the time. Your muscle is your metabolism. If you lose it and you slow your burn rate long term, you're going to end up with that that skinny fat look that everyone's kind of seeing is happening with these drugs. So yes, the number on the scale went down, fantastic, but your body is actually more fragile and less healthy, and your metabolism is probably going to be much slower and more impacted because of that. And so again, now getting into the second thing on the list here, slowed metabolism. These GLP-1 agonists slow gastric emptying. So that means your digestive speed, really, and it reduces the appetite to where people are going to undereat a lot, sometimes even for months. And so the result is your body is smart. Your body says, okay, I'm not getting enough in. I need to slow down my burn rate, my metabolism, to keep what I have so that I don't die, right? Our bodies are built for survival. And so when we're taking in less calories over time, that's why, these dramatic calorie restriction diets don't work long term, because you're going to starve your body into a state of survival mode. It's going to just preserve every calorie it gets. And so eventually you can't not eat anything, right? You would die. And so, it's like putting your body on airplane mode. You're not teaching it to regulate. You're just overriding the system. The next thing we're seeing with these drugs is gallbladder stress and pancreatitis risk, because your pancreas is what controls that insulin glucagon kind of response and cascade. And so there's been multiple case studies linking semaglutide with acute gallbladder attacks as well as pancreatitis, especially when the weight loss is super rapid, right? When people are losing 30 pounds in 10 days or something crazy like that. There was a 2022 meta-analysis in the Diabetes Care Journal noted a statistically significant increase in gallbladder-related adverse events in GLP-1 users, like a direct correlation to it. And so, again, these aren't things that are taken lightly. This could put you in the hospital or require some type of surgery to pull your gallbladder out. Your gallbladder, I know a lot of people get them removed, but it's actually very important. It's necessary for your digestion, your body's detoxification, a lot of systems in the body. The next thing that happens is people often get, as you said, that rebound weight gain. So, most people are going to lose a ton of weight, but they really haven't changed their lifestyle. They haven't modified anything that they do on a regular basis. So as soon as they get off the drug, they're still doing what they did that got them there in the first place. That weight just comes right back because they haven't changed any of their habits or routines. And so there was a 2022 follow-up study in the New England Journal of Medicine showed that participants regained 2/3 of their lost weight within a year. So it's almost like, what was the point, right? They just bounced right back to almost exactly where they were, even after discontinuing the drug. There's psychological dependence that comes from this. People, start to believe I need this. I need to stay on this or else I'm not able to eat right. I'm not able to, this is the only thing that's ever worked for me. And they get hooked on it. It's almost like an addiction to the feeling. And it's a problem because, this is lack of control, right? People are so out of control with being able to manage what they're putting into their body and the amount of movement they're doing. They're relying on these things. And then the last thing, and not to go unnoticed, is malnutrition. People are eating so much less on these drugs. They're not getting the micronutrients and the vitamins that they need. We're seeing depleted B vitamins, low protein intake. So they're not getting those amino acids for rebuilding and repair. Again, if they're not consuming enough, you better believe they're going to be deficient in a lot of minerals and vitamins. And so, the way you and I talk about it is you can lose weight, but you can still wreck your health while doing that. And that's not winning ultimately. So again, I think a lot of people listen to the way we speak about these things and maybe think we're anti-medicine. We're not. We're just anti-medicine in the wrong uses, right? We're pro-integration. Because if you're not combining this drug with movement, strength training, nutrient-dense meals, and mindset work, right? Controlling where your mindset is, you're setting yourself up for failure. So it can be done correctly. We're just not seeing that very often and done very well right now. And so, let's get into segment 3. I'll let you take this. But real quick, let's take a word from one of our sponsors. This episode of Health Decoded is brought to you by Authentic Nutrition, the brand redefining what it means to fuel your body the right way. At Authentic Nutrition, they believe that what you put into your body matters. That's why every single product is crafted with clean, premium ingredients and dosed with maximum efficacy to ensure you're not just meeting your health goals, you're exceeding them. No fillers, no shortcuts, no gimmicks. Whether it's their advanced supplements for energy, recovery, or gut health, you can trust that what's on the label is exactly what's in the bottle. Authentic Nutrition delivers science-backed formulations that work as hard as you do. If you're tired of products that promise the world but don't deliver, it's time to make the switch to Authentic Nutrition. Elevate your health with transparency, quality, and results you can feel. Check them out today at AuthenticNutrition.com and use promo code Alessi15 to get 15% off. That's THENTIC Nutrition.com, promo code ALESSI15 to save 15% and take the first step toward real, lasting health. Authentic Nutrition. Fuel your best self. Now back to the episode.
And we're back. So thanks, Dr. Alessi, for all that. And I'm going to build onto that in segment 3, right? And the root cause behind that, obesity and the weight gain element. This hits home because there's actually been a lot of friends of my wife, because this is predominantly, I think this is coming into the more masculine side of the world. And there's been a driving force behind it because there's so much rapid use within the feminine side, right? The females have really, really expanded, move this drug along. And now men are also, I want to hop on this gravy train too, right? But we got to talk about the reality of the obesity and the weight gain behind it, right? So we've become so obsessed with the shrinking number on the scale and the immediacy of that effect, right? So we've stopped asking the right question. Why is the body gaining and holding on to fat in the first place? And the real issue isn't a semaglutide deficiency, right? The issue is that the modern life is metabolically hostile. We talked about this over and over again, right? Inflamed cortisol levels, just crazy, erratic hormonal responses to things, right? And our bodies are doing exactly what they're programmed to do in the stressful, toxic, nutrient-poor environment that we perpetually put them in. So let's walk through this real root cause we see in our clinic on an everyday basis. So number 1 being insulin resistance. It's one of the most important things is to be insulin resistant. Most people are weight loss resistant because their cells are numb to insulin. This hormone is supposed to help shuttle glucose into the cells. But when the system is just overwhelmed by sugar, stress, and snacking, it completely stops working. So what happens? Glucose stays in the blood. The body stores excess fat, and cravings, fatigue increase. Here, check this out. A 2021 review in The Lancet noted that insulin resistance is one of the primary metabolic drivers of modern obesity. And this is another thing. You know how you become more insulin resistant is by moving directly after a meal. Moving, doing something in movement, walking, push-ups, air squats right after a meal, right? Right after a meal. Every time you have a meal, do something, move. So number 2, chronic stress and cortisol dysregulation. When your body thinks it's under threat, so there's different threats that you're going to be perceiving, whether they be subconscious or conscious, right? Even from an email notification or under eating, it holds on to fat for survival. Subconsciously, you don't even know what's going on, right? Cortisol, stress hormone, elevates your blood sugar levels, breaks down the muscle tissue, and tells your body store fat, especially around the belly. I can even feel it. So I have a low body fat percentage, relatively low, I should say. So whenever I eat fats, carbohydrates, it actually pumps up my muscles, right? And subconsciously, those carbohydrates and fats are going into my muscles and almost swelling them in a way. All food is meant to inflame the body, right? Then it becomes your body's natural response to insulins to regulate that appropriately, right? So chronic stress equals metabolic slowdown and inflammatory weight gain. Reality. So you keep the body in more of a stress state, you will have more weight gain. You eat and sit down, you will have more weight gain, right? So number 3, mitochondrial dysfunction. So this one's really cool because I'm actually tapping this into a detailed level with a new peptide that I'm trying out, which is the SS31, right? SS31 or SS32?
Yeah, that's
31, right? So your mitochondria are cellular engines. So when they're sluggish, your metabolism is too. What damages mitochondria are a number of things: inflammatory foods, environmental toxins, poor sleep, and sedentary lifestyle. You eat, you sit, that's sedentary, right? So here, when your engines aren't working, taking a car example, your body burns fewer calories, right? It's going to burn fewer fuel. If you're not burning the machine, the car, so you're going to use less fuel, right? And at rest during exercise. You see how that works? You're going to maintain fuel, and your body converts to storage. So here's from the Journal of Clinical Endocrinology and Metabolism in 2019 linked mitochondrial health directly to resting metabolic heart rate and fat oxidation capacities. We'll dive deeper in that, so take note. So number 4, hormonal imbalances. We talked about so much of this in prior episodes. We've really gone in detail, but this is the nuts and bolts, right? Weight gain isn't always about willpower. It's about hormones. That's why we get blood work done on everybody that comes into the clinic. I was talking to a guy the other day. You just need blood work done. You need to have an understanding of data in your body. Do you have a low thyroid? Well, that's going to equal slow metabolism, right? Estrogen dominance. Does your test, if you're a male or you're female, right? Do those equate? Do those level out? Are you heavier on the testosterone side if you're a male? Are you heavier on the estrogen side if you're a female, right? Those need to, and then what is your free testosterone balance in association to your top line testosterone or estrogen, however you measure those. So bloating, fluid retention, and fat storage are an association to excess estrogen dominance if you're a male, right? Low testosterone in men or women. This is a key thing, right? Is women don't realize that testosterone is needed and there's a balance between the estrogen and testosterone and vice versa for men. So you have less of that, right? There's less muscle and more fat. So if you're a woman getting maybe a slight pinch, of controlled doctor approved testosterone is a very, very healthy thing. And your man's going to thank you for that too. So PCOS is another factor, right? Equals insulin resistance plus hormone chaos, right? At the end of the day, if your hormones are out of sync, your body is not playing fair with itself. And that's all subconscious state. Now, we're going to dive in to a little bit deeper issue. Again, we've had prior episodes on this, but what I love about this is this all is regulated, associated to your hormone levels. What regulates it? Your sleep, circadian rhythm, and the disruption in poor sleep is directly related to hormone balance that you have when you're awake and in your awakened state throughout the day. So poor sleep wrecks your hunger hormones. It goes up, leptin goes up, so you crave carbs and eat more. Also, take note, what you introduce first to your body is what you're going to crave through the rest of the day. So if you introduce your body to carbs and fats earlier in the day, which I'm not completely sold on the fats. I think that fats can be introduced a little bit earlier just because they have a neurological component, but mainly carbohydrates, you're likely going to crave those the rest of the day, right? So that's why protein's important earlier in the day. So lack of sleep also spikes cortisol, impairs your glucose metabolism, and lowers insulin sensitivity. Here's another study. We always like adding these in. The American Journal of Clinical Nutrition in 2021 found that just 1 week sleep deprivation significantly decreased metabolic rate and increased fat storage pathways. So it just allowed it, right? Allowed fat to store because you're not getting the efficient amount of sleep. This then, and for number 6, as we're transitioning, led to toxic burden. So we see this all the time. Patients who are doing everything right, but still inflamed, tired, and stuck. I can't sleep well. I can't do all these things. Well, hidden toxins are built up, mold, plastic, pesticides, and they disrupt the endocrine system, which impairs those detox pathways. Your body naturally wants to detox itself, but you're not letting it, which create low-grade inflammation that blocks the fat cell loss. So, hey, I'm going in, I'm working really hard at the gym, but not seeing the results, right? Functional medicine calls this toxic bucket. We test for this on a weekly basis with our patients. And when it overflows, your metabolism stalls. So forget it. Your body's just going to continually store. So now as we build into it, gut dysbiosis. And this is the root associated to everything that we talk about and do. This is why you need to get your blood work done, because once you get your blood work done, that perceives data, and then we can get niche with what is going on, right? We read your blood work, we get niche. Hey, this is what you need. You might have, we see leaky gut almost on a daily basis, right? So the gut dysbiosis, if your microbiome is out of balance, your weight will be too. Fact. Absolute fact, right? Certain bacteria extract more calories from food. So that's why we want healthier gut bacteria, not more unhealthy. So gut imbalances trigger inflammation, leaky gut, and low microbial diversity is linked to obesity and insulin resistance. They've literally done a study in Europe right now where they're doing actually fecal transplants to change the gut bacteria, and it can be changed in as little as 3 days. And in that 3-day period, you can, with fecal transplants, implant good gut bacteria in a foreign gut, right? And it'll start recreating gut, and you'll start losing weight. Your hormone balances will equate, right? It does come with also some other things, right? You need habits, right? You need to build in habits because you will then still eat the same things. But they are doing this in Europe. They have test trials going on right now. It's really, really cool. Check it out. So fix the gut, reduce the inflammation, improve weight loss regulation. So it's as simple as that. Here's my final thought before I check out and give back to Dr. Alessi. We don't need more suppression. We need more restoration. Think of that, right? Suppressing hunger with a shot doesn't fix insulin resistance. Well, I mean, technically it does, right? It does fix it for a period of time. What comes in after that, though, is it doesn't clear the toxins or reset the hormones and really heal your gut for the long term, right? You want the long term. You don't want to be on a shot forever. And it just silences your body's signals without solving the real root cause. So sustainable weight loss stems from metabolic healing, not just caloric restriction.
Yeah, that's so true, man. And literally all 7 of the things you touched on in that piece, there's an episode 4 that we've done. So if listeners want to go back and really kind of get more knowledge on each of those, right? Like you gave a snapshot of them, and now go back and listen to a prior episode on gut dysbiosis, toxins, the circadian rhythm, hormones, mitochondria. We've done an episode on all of it. So, really kind of builds the picture there. The other thing you said was, the shot isn't the fix because, yeah, it'll make you lose weight. But if the reason you're losing weight is because of a dysbiotic gut or your habits are off or hormones, the shot's not meant to fix that, right? It's meant to just suppress your appetite so you eat less, calories in, calories out. You're taking in less calories. Yeah, you're going to lose weight. Is that healthy weight loss? More often than not, it is not. So we're seeing a lot of muscle loss like we talked about. So realistically, what is the alternative? Because everyone's looking for the shortcut. Everybody wants the magic bullet, the quick fix. I'll be honest, I sometimes do as well, right? But what we do at Alessi Functional Health is what we call metabolic reeducation. So we're not just trying to silence the appetite. We're trying to teach your body how to burn fat again. We don't rent your metabolism. We rebuild it from the inside out, right? Mm-hmm. And so let's do this, man. Let's just break down kind of our functional medicine blueprint for how we get real weight loss goals that last. I think that's the biggest piece, right? Is like anyone can lose weight. Anyone can get out of pain, right? That's easy. It's keeping those results that separates us from other practitioners because we've got these systems in place that, again, it's education for our patients that make it to where they just need to maintain afterwards. So, step one, like you mentioned, advanced testing, right? You have to know before you go. What gets measured gets managed realistically. And so before we ever build any kind of plan or claim to be able to help someone, we have to have an answer. We have to know what's going on. So some of the big things we're going to look at is that fasting insulin. That's more predictive than glucose. We're going to look at cortisol patterns and a daily adrenal stress test that tests cortisol 4 times throughout the day to see really what is that cadence. A thyroid and sex hormone panel, toxic load, kind of what you mentioned, right? Looking for things like mold, BPAs, heavy metals. And then one of the biggest ones is going to be like a microbiome and gut test, where we can look into the stool and see what levels of good, bad, beneficial, dysbiotic bacteria there might be. And there was a 2022 review in Obesity Reviews that confirmed that individualized biomarker-driven protocols led to more sustainable weight loss outcomes than just generic calorie counting. We know that just counting calories can eventually hit a plateau, right? If you're just maintaining under calories forever, it's not sustainable. And so it's all about like fueling your body and then using those calories as fuel to then achieve said outcome. So personalized nutrition, that's the next piece of what we do, because it's not about restriction, it's about optimizing your nutrition. We help guide patients with high protein diets. That's going to preserve muscle mass, boost your thermogenic ability, your metabolism, blood sugar stabilizing meals, incorporating fiber, fats, and protein. And then obviously anti-inflammatory foods, getting rid of the seed oils, getting rid of the processed carbohydrates, the triggers, right? We do food sensitivity testing to see if someone has triggers like dairy, gluten, maybe certain types of vegetables that could be triggering them that they don't know. And so it's not just eat less, move more, it's fuel more, right? And strategically as well. The next piece is something that everyone gets coaching on this, is strategic movement, right? And so it's all about like focusing on metabolically intelligent exercises. That zone 2 cardio that you always love to talk about, right? Enhances fat oxidation, mitochondrial function, and then resistance training. Everyone needs to be resistance training to build lean mass, which will improve your insulin sensitivity. Your body will be more responsive to using the insulin. Muscle is medicine. And according to the Journal of Applied Physiology, muscle mass is a major predictor of metabolic rate and glucose control. It's just proven. And so if you're not working out, but you're planning to just take a semaglutide or a GLP-1 agonist, your body's not going to be metabolically active. As soon as you stop that drug, it doesn't know what to do. The next thing is using, microsupplementation for the mitochondrial and cellular support on the cellular level, because you mentioned it. If the mitochondria is not working, neither is your metabolism. Those are the engines. Those are the fuel cells. And so we use specific supplements and protocols, things like CoQ10, PQQ, acetyl-L-carnitine, which helps transport fat. Alpha lipoic acid makes your body more insulin sensitive. And again, they're not fat burners. I know that's like a buzzword. People are going to go buy a fat burner on Amazon. These are cellular repair tools. Again, getting to the bottom of it. Like, what is the actual problem? And then gut restoration, liver detox. So chronic inflammation and poor detoxification will stall your fat loss. So I always tell patients this when weight loss is a goal. I say, hey, if your body's not healthy, it's not prioritizing losing weight. So you could be trying to do all these things to lose weight. Your body is just trying to keep the lights on because there's some kind of fire that's going on that it's just trying to manage. I think an analogy I used, which actually kind of made me and the patient both laugh. I was like, imagine if you had a house that was on fire. Is your priority to repaint the walls of that house? No, it's not. It is to put out that freaking fire, because if that fire is going, then what purpose is it to make the house look nice, right? So we use, we address obviously dysbiosis and leaky gut, and then we're going to do specific detoxification protocols where we use enzymes, probiotics, repair nutrients for the gut. Now getting into more of the cooler things we do when needed, peptide therapy. Again, peptides are not a silver bullet, but they can be a powerful accelerator when used correctly. And so you have to work on the foundation first, but then we can get into some really, really cool niche things with these peptides. Things like CJC and ipamorelin, which you and I have both used. these are going to stimulate that natural growth hormone like release for fat loss, muscle maintenance, and recovery. MOTS-C is a mitochondrial peptide that improves your glucose utilization and stamina. And then the 5-amino-1-MQ actually inhibits fat accumulation and increases your energy output. The cool thing about that one is that one can actually be taken orally. So most peptides are going to work best with an injectable, but the 5-amino can actually be taken orally. And so some patients are going to have more follow through with that. And again, we pair peptides with lifestyle, not instead of it, right? Everything. It's not to overdo your life. It's like it's an add-on, right? It's a supplement. And so then, one of the last things we're going to talk about is really the nervous system support. And so we talked about this in a previous episode about the vagus nerve and how important that is for regulation of the nervous system. Because if you're dysregulated, you're in that survival fight or flight mode, your body's going to just store as much energy as it can. It's going to say, hey, I need this in case of, something happens and I need that energy right away. I'm just going to store this. I'm going to bank this for later. So we monitor HRV, heart rate variability, vagal tone, and then utilizing hacks like breath work, cold exposure, sleep optimization, exercise, obviously, and all these things to help calm the nervous system so that the metabolism can function again. And so, all of that put together really is what we call our total care approach. The reason we came up with that name is because it encompasses everything: the testing, the lifestyle factors, the movement, the supplementation, the nutrition, like all of it, right? The nervous system. And so our total care program isn't just a hack. It's not about hacking your biology. It's not a biohacking thing. It's about root cause healing, lifestyle reprogramming with science-backed support from our doctors and from our team. And our team is, next level good. So, the takeaway here is we'd rather help you rebuild a fat-burning, rich body than rent out your metabolism from Big Pharma for $1,000 a month. That was a great quote. And so, if you're thinking about trying Ozempic, or if you've tried it and you're frustrated with it, just know that your body deserves more than symptom suppression. It deserves to just be healthy. And so rather than try to override the system, let's fix the root and not just flatten the curve. So to learn more about how we help diagnose, reverse, and heal chronic disease within our functional medicine programs and Alessi Total Care, go to alessifunctionalhealth.com, schedule a consultation with me or one of our other providers, and let's create a personalized plan for lifelong health. You can go to our resources page and click on the quizzes link to take a quiz specific to your symptoms and see if this is something you can benefit from. Listeners of the Health Decoded podcast always get exclusive discounts and price reductions on our protocols and our lab tests. So be sure to mention where you heard us.
And as always, if you found value in today's show, please like, subscribe, and share this episode with someone that needs to hear it. That's how we're going to get this message out and change more lives. And want to get in touch with us and be featured maybe on an episode? Email us questions at ask@alessifxhealth.com. And you can visit our website at alessifxhealth.com. You sign up for our newsletter, check out our resources page to learn more about our approach to nutrition and other cutting-edge therapies.
And thank you again for tuning in to Health Decoded, where we break down the science, bust the myths, and help you take control of your health naturally. Till next time, I'm Dr. Alessi. We will see you on the next episode.
Thank you for tuning in to Health Decoded, where we break down the truth about all things health and empower you to take charge of your well-being. If you found value in today's episode, please subscribe, leave a review, and share it with someone who needs to hear this. For more resources and personalized support, visit us at alessifunctionalhealth.com and sign up for our newsletter. To hear your questions answered live on the show, send them to ask@alessifxhealth.com. That's ask@alessifxhealth.com. Until next time, stay curious, stay empowered, and remember, your health is in your hands.